first got here, it was pretty sunny every day, but now it's a little grayish. Still so beautiful though. Ooh, look at my sugary drink. Okay. What do you want to talk about first?
Okay. We can start with like logistics.
Okay.
Do you feel good about the
Yeah.
setup? Okay. And the volume and everything? Is
I think
okay?
so. Yeah.
Okay. Okay. So a lot of the comments that we've been getting are around. Do you think the waves are going to be too loud?
We'll see.
Okay, a lot of the comments that we've been getting are that people want to see more long format Q&A of Lorenzo and I kind of just answering some questions. So we want to give that a try and try to answer some of the questions that repeatedly pop up and share our responses with you guys in a long format. This is where we're staying, so it's the Blue Lagoon and we're right on the beach and it's probably one of the most beautiful places in the world. It's also one of the most isolated places in the world.
Chuuk, Micronesia. We're in the North Pacific.
North Pacific.
And to get here, there's only United flights. So that is the only airline that services it. There used to be another airline, which I'm forgetting the name of, but they had a crash where their plane overshot the runway and went into the water. And since then, they've basically been kicked out. So now United has a monopoly on this place, and it makes it pretty hard to come here and leave. So a lot of the locals just can't afford to leave because flights even to Guam, which is about 2 hours flight away, are like $400, $300. So
I guess
that
we can
is to say that it is isolated, hard to
so
get to.
One of the questions is travel. So we'll give you our return route because we came from Nepal here and that's a little different, but our return route is going to be Chuuk to Guam. That flight leaves in the middle of the night at 2 o'clock in the morning. And then we're in Guam around 4 a.m. until 7 a.m. From Guam, we fly to Tokyo. We'll be in Tokyo for about 8 hours. And then from Tokyo, we fly to Chicago. That's a 12-hour flight. And then in Chicago, we are renting a car and driving 3 hours to Appleton, Wisconsin, where Lorenzo's parents live. So even though the full journey takes over 24 hours, we actually end up arriving in Chicago the same day because of the time difference. So we don't end up losing a day in that direction. So from west to east, we end up staying in the same day. But
Yes,
if you go
because
from
we're
east to west,
we're
you
so
lose.
close to the date line.
Is it raining?
A little spitting. We may have to run, but because of the date line, we're on basically the opposite side of the date line as most of the U.S. So we're usually a full day ahead of here. So time difference gets a little confusing.
It gets very confusing.
I feel like I'm doing calculus every time I'm trying to figure out a meeting
Oh,
back
but
home.
two life hacks for this is, number one, our phones, when we first got here for the first 3 weeks or so, were syncing to Ponape, which is another state in Micronesia, or in the Federated States of Micronesia. And we couldn't figure out how to turn that off. And the way that you do that is you have to turn off your screen time settings. So my phone gives me alerts when I go over my screen times to get me off my phone. And you have to turn that off to be able to manually set the clock on your phone, which we had no idea. And then number two is that in your time, you can put all the different world clocks. So you can have the time for, I have Salt Lake, Boston, Istanbul here, and that way I can just quickly from my phone see what time it is other places. And look at this girlfriend. Okay,
Yes.
So the next question is, how do we afford it? How do we afford global outreach? And this is a really good question, and it changes depending on the stage of your career. So we can talk about what we're doing this year to afford this, and then I can kind of talk a little bit about in the past. So this year, I am a global ophthalmology fellow with the Moran, and I am doing a 6-month fellowship, which means that I work with partner organizations with the Moran. And the Moran pays my salary as if I were a fellow for this duration, so I get paid like a PGY 5. They also pay your flights, they pay your housing. And in exchange, you are the representative of Moran in our partner countries and working on behalf of Moran. And so that is how we are funding my part of it. Lorenzo does have to pay for his own flights. We have gotten really, really good at points hacking over the
Yes.
past 2 years.
Well, let me just mention how I'm self-funding this is. I finished my fellowship in wilderness medicine, and there's not a lot of jobs where you're an employee and have a contract that you can just take months at a time without them being a little unhappy. So I decided to do just locum tenens, which is temporary staffing work in places where you fill the gap of if they have an increased need of providers or if somebody's going on vacation. So I found a place that had a need right close to where my parents live in Wisconsin. And basically every time we fly back home to both to keep up my skills and also to keep up our finances, I work some shifts there. But during my time here, I am without an income, so we're just going off of Scylla's income.
But thankfully, we don't have any cost of living. So our housing is paid for, our food is paid for. So we are able to live off of one income. And then honestly, when he is stateside working locum shifts, of course, because he's getting an attending salary, he's making more than me, basically. This year, he'll end up making more than me despite doing shifts periodically when we're back stateside. So every other month or so, he's working a bunch of shifts, making money that way, and then I'm working kind of more continuously. So that's how we're making this year work. Now, next year, we will be living in Honolulu, where we both have our contracts for our long-term positions. And in that instance, I was able to negotiate a contract that gives me time to continue global outreach. And that was through long discussions with my future employers about what I'm looking for in a position and what they're looking for in someone joining their group. And so we were able to come to an agreement where I will still have dedicated time each year to work in global health. And so that's something that you can negotiate when you are looking for your job, if that's something that has been an important part of your career path and that you hope to continue in your career moving forward. So we kind of
Hold
talked
that
about
one
this.
second.
So we kind of talked about this one already, but how did we choose the location of this work? So this specific...
Oh wait, so we talked about how we're how we're paying for our life currently, but to give an example of how you can do global health work, not as an attending, not as a fellow, we did global health work in pre-med, at the end of college, before college, and all of those instances were through either grant funding or through nonprofit programs that essentially are like a work stay program where you get housed with a local member of the community. They feed you and you go to the clinic or whatever volunteer service you're doing. And maybe sometimes there's a grant to cover a stipend of airfare.
Yes.
But usually it's pretty, it's pretty tight on the wallet. You know, you're not doing anything glamorous. You're just going based off of whatever savings you have and using grants money. So there you have to put a little bit more legwork in terms of applying for and finding programs that fit the whatever sort of program you're looking for.
And usually different universities will have grant funding as well. So a lot of my work in undergrad and in medical school was funded through university grants that you can apply for, and they usually have funds specifically for students to work in global outreach. So that's something to
What
definitely...
numbers are you seeing on the grants, like in terms of the amount they're paying you?
Generally, it would cover flights and housing.
So like
Flights and housing.
the grants and or scholarships, whatever they may be called, that I've had in the past range between $1,000 and $2,500
Yeah.
for the period.
Yes. Yeah, for the
and
summer or whatever period of time.
And if you're
you
lucky,
need it.
you can link a couple of them together.
Yes. Okay, how did we choose this location? So it's through Moran. So I work for Moran. Moran has partnerships.
What is Moran?
Moran is the University of Utah, and Moran has a huge global outreach department. They do incredible work. They were one of the first global ophthalmology departments in the world, really. And they have established partnerships, and we send fellows to each of those partner locations. Lorenzo and I preferred to come to Micronesia because we will be working in Hawaii, and so we want to continue our partnerships in the Pacific. He had worked in Samoa before, and so we're developing these relationships.
How is this different from other global health work we've done? Well, I think one of the biggest surprises for me, coming from most recently having done some time in Samoa, I spent a month there. I had a very targeted goal or job where I was planning on doing point of care ultrasound, teaching to the emergency
I
doctors.
love watching the pig chase the dogs. The pig literally just chases the dogs around.
Well, they are basically all land puppers, aren't they?
Yeah.
So it was pretty different from this experience here, both culturally. I had to I thought that Micronesia and Polynesia were going to be similar, but culturally Chuuk is a different animal. Here we're doing a lot more basic kind of teaching and training in terms of BLS, ACLS, protocols in the operating room, whereas there it was a more developed healthcare system. So it's just a different way to tailor your experience when you come in as the attending. And so that's been the difference between my last two experiences. We came from Nepal.
I'm used to being at highly organized academic center powerhouse, which is a completely different setting in a high income country and then like a middle low income country, which was where I worked at Tilganga Eye Institute in Nepal, to coming here where there isn't really a formal eye department. I'm the only ophthalmologist. I work with a team of nurses and public health, community health workers. And so adjusting to that and really being the one in charge of preparing all of your medications for surgery, being your own ophthalmic technician or training the nurses in ophthalmic technician work, in clinic, reviewing just very basic fundamentals, how to check a patient in, what are the vital history points that you want to ask all patients, how do you check a vision, things like that. It was very challenging at first. I mean, the first couple weeks were really, really challenging, but the team here is phenomenal. They're really motivated, and I'm fortunate because I have a team that works with me every single day. And so together we've all gotten so much better over the last few weeks, but it was definitely shocking. I think of all the places I've worked in global health, and I've been working in global health for 14, 15 years now. This was one of the places where I really had to take a step back and learn some fundamentals about jobs that were outside of my own so that I could better serve my team and our patients.
Mm-hmm. Yeah, it was a very challenging experience, especially in the beginning, because our expectations were vastly different than what we came into, and just seeing a lot of bad outcomes was really challenging emotionally, and knowing how different things could have been, and if with the standard that we're used to, of course that's not something that you need to go ahead and do global health work with. But when you are in those situations, it's hard to extricate yourself from the emotions, and going back to the basics has been really helpful in terms of making sure people have the same fundamental technique and training.
Okay, so is it possible to do this work as an independent practitioner? What are some challenges and ways around it? I would say that if you are interested in global outreach and global community work, then I would try to work within an organization for a couple reasons, or at least someone that has a partnership somewhere, because when you show up somewhere, it takes a while just to develop those relationships, to establish that trust. But when you're working as part of a greater organization, that lineage and that trust is kind of already built in. So when we came here, I was a representative of the Moran. Lorenzo was an extension of that as well. The Moran helped to make sure that he had his licensing and things like that. And we had an established partnership. So there was already, I mean, of course, we faced there's always some hesitation. People don't know you. Who are you? What are your qualifications? How can we be sure that we can trust you? But it's much easier to develop those relationships and that trust if you work with a partnership. You could come here independently, but it would be...
I would say, I mean, I think I have more of an independent practitioner approach.
Yeah.
Because although I'm with you as a Moran ophthalmologist, I'm not really associated with that, and that's, you know, I'm not saying I'm from Moran, but we come as a package, which is nice. But if you're not coming as a couple in that situation, I think it's possible, but it requires either some contacts, making connections in the area or the region that can make an introduction. And if you do have to do cold emailing, having a very clear idea of what the sort of project you're looking for. So in Samoa, I became introduced to one of the ER doctors through a conference, and that was my way to sort of establish an idea of what needs they had and what they wanted from me. Here, I had some contacts through her presence here, but it was a lot of emailing around and seeing who the right person to talk to and getting buy-in that, you know, I'm not just a random person, but, you know, I have a goal and a mission here. So it's possible, but it definitely is easier if you are coming with the backing of an agency or a nonprofit or some sort of a group.
And it's better because you
ensures
can have
you have
more
longitudinal
of an impact. Exactly.
impact.
And speaking of that, like, one of the things that we've noticed during our time here especially is that there are all these organizations that want to help and that send people here, but people come for a week at a time, and it's really difficult to have your finger on the pulse somewhere having only spent a week there. I mean, our first 2 or 3 weeks were just trying to figure out how things really work. So there's how things work when you first get here for the first week and how it looks on the outside, and then there's how things really work when you're kind of living and working in that environment. And so if you have the opportunity to spend a little bit of a longer period of time somewhere to establish those relationships, that's very important, because now we can come back for shorter periods of time because we know the system, we know the people, we know the stakeholders, they know us, and we really have a better grip on what it's like to live here and to work here, versus when you come for just a week, you get a very surface level understanding of what things are like in the system that you're working in. So I think that's another important thing. It's not always possible for everyone, but if it's not possible, then you really need to know someone that has done that does know those things, that has spent a significant amount with that community, because otherwise you're basing what you're able to give to the community on assumptions that you make after such a short period of time. Okay, how do you ensure that you're welcomed back again? I think...
Here you go. I'm just checking.
I think one important thing to think about in general is to make sure that you are serving the communities in a way that they need and not in a way that you want. So for example, as a surgical field, and especially a high volume surgical field, sometimes in ophthalmology we can focus on, let's do as many cataract surgeries as possible because our donors like to see the numbers. And that's great in certain instances, but oftentimes what the community needs is capacity building. They need you to slow down and teach them how to scrub for the OR, how to set up an ophthalmic tray, how to screen patients in clinic, how to run an OR, how to run a clinic. And so those things are just as important, if not more important. And if you're not listening to the community that you're working in, then your presence can sometimes create more stress than good. So I think one of the main things about being welcomed back is making sure that you're serving them in a way that they need and that they want, and you're listening to their needs.
I've also seen situations where people come in guns blazing in terms of they have a plan and they want to set up a triage system for the emergency department. And they're like, well, oh, we can't have this there, we can't have that bed there, we have to restructure everything. And you're coming in as a complete stranger to everything, the culture, the healthcare system, how things have been running for who knows how long. And you just have to, maybe you could be right as rain in terms of that stuff, but you have to massage that in. People don't take very kindly to, foreigners coming in and saying, you're doing it all wrong, let's restructure. It has to be a little more nuanced. And that's how you build that long-term relationship.
Okay. What has been the most challenging aspect of the trip?
I think this is, I work in emergency medicine, and this is the most exposure to death that we've had, I think. For her, definitely, because she's an eye surgeon, but you just can't escape it. Like, it's just everywhere in the hospital. Like, even our entrance, we come in through a back entrance of the hospital. It's right next to the morgue, and like every other day, there's a death and family mourning, and it's just very, very challenging to see every day.
Yeah.
In terms of the work, there's sort of an expectation that people with serious illness are going to die. The hospital struggles a lot with resources, both supplies and facilities like laboratory testing. There's no CT scanner. There's very limited specialty care, and so if you have a serious medical illness, chances are you're just not going to do very well. You're not going to be able to get the care you need, and so coming down to that level and that expectation has been really challenging for us, but also a catalyst for wanting to put in the effort and put in the time to see if we can make little changes at least that can help in certain situations.
I think for me, the death thing that he's alluding to has been very difficult to cope with. I already wasn't great at setting boundaries with patients and becoming emotionally involved with people when I was an intern, which we know. And so whenever I had a patient of mine that would pass away, it was really hard for me to deal with that. Thankfully, I'm an ophthalmologist and we have overall very good outcomes. But here, just seeing that and seeing some of the kids with malnutrition and things like that has been challenging. I think the other side of this is kind of the professional challenges that I face as a global ophthalmologist here. And one of the things that I was really shocked about as a surgeon was how little I actually knew in detail about everything that happens around the surgery. So I keep calling it peri-surgery because back home and even in Nepal, where there are systems already in place and strong systems, as the surgeon, I walk into the OR, I'm focused on the surgery. Like, I need to know my patient very well and I need to know the surgery very well. I'm not drawing up and mixing my own medications before the surgery starts. I'm not setting up the microscope, the operating tray, opening up all the sterile equipment, making sure that everything is available and accessible, wiping the OR floors, wiping down all the beds and all the tables. Those are things that I'm not thinking about. But now I know how to mix the formulary of any type of block that I need, prepare my trypan, my injections at the end of the cases, any intracameral meds. I know how to set up the tray. I know how to make sure that the timeout is run correctly. I have signs all over my operating room with all the different meds that we need to pull, how every tray should look, how we should pull buckets. We call them buckets now, of what each surgery of the day will look like. So let's say I have 10 surgeries. The day before, I'll pull every single disposable, consumable, and instrument that I'll need for that case and make sure that it's ready. So those are things that back home are run completely by our ophthalmic surgery team, and that's something that the surgeon doesn't have to do. So even down to making sure that, like, I have the right size blades for everything, things like that. So that was really challenging.
Yeah, that extends to my department too. I think we're
Dosing for medications that we both are like.
right. We're just so used to a certain level from every role in the healthcare system um, that I work, in a situation in a lot of in most of the United States, people are rock stars. Like the emergency nurses are incredible, the pharmacists are incredible, techs. Everybody is working at such a high level within their scope that you don't even notice. Things just happen fluidly. And
Yes,
here,
you don't notice what you are not responsible for, and then
Yeah.
when you are responsible for every single detail,
yeah,
you recognize how much each individual player
Yeah.
has been contributing.
and the reason why is not just, it's not a global health problem. It's more of the country doesn't have
The resources.
training for the medical staff, for the nurses, physicians. There's no medical training program that provides that pipeline
Right.
of people. So getting a good staffing model has been really challenging and hard to continue that medical education longitudinally. So that is one of the biggest challenges for sure.
And then challenge is just being here. I think the time difference is tough to be able to talk to friends and family.
Well, we were here
And
also like during Christmas and New
Year,
Year's, so
and
being away
Lorenzo's
from
birthday.
family
so it was
is
like 3 big holidays, and we've been gone for what, 5
my
months?
birthday is a holy day.
It is a holy day.
Very holiest
It is
of
a
days.
holy day. And we've been gone for 5 months now, and that starts to wear on you. Like, you miss creature comforts. So,
Scylla
for example,
misses bean burritos.
I miss bean burritos from Taco Bell. Okay,
Like she's
and-
like fantasizing about them.
this is a real need.
Tell them
And this
about
is-
our friends that
So
brought
we
her.
made friends with a couple. One
They
of
live in
whom
Colorado.
They live in Colorado, but the male of the partners is here for 6 months, working as part of his work with the U.S. Army, and his girlfriend Alyssa is here, and she brought like a whole Ziploc baggie filled with Taco Bell hot sauce, and he doesn't really like it, so she gave it all to me, and it was just, I almost cried. I was so emotional and so
Yes.
happy. But like, even
It's the little
beyond that,
things.
thank God it's really warm here, but I haven't had a steaming hot shower with good water pressure in months. And it seems so insignificant because we really are living in comfort here compared to some of the other global health work we've done. Like, we've lived in conditions that I can't even fathom anymore, but we were young and we were resilient, not that resilient anymore. We live in a beautiful location, beautiful hotel.
It's a resort.
It's a resort. It's like a
Yes.
compound.
It's the
But there's-
dive resort on
the island.
On the island. There used to be another dive resort, but now this is the only one, and it's got a perfectly manicured lawn.
Yes.
We eat at the restaurant.
We have our own room, but we don't have a
Yeah.
kitchen.
I mean, it's
We
Really-
don't have like a living space. We just have a room with a bed and a
Yeah,
cold
it's a
shower.
hotel.
And a cold shower
hotel life.
is the main thing. So not having a hot shower is really taxing. So honestly, it sounds juvenile to say that that's a challenge, but it really is. Like, after, that's okay for the first couple weeks, but after a couple months, you really wish you could just like burn your skin off in the shower.
I don't.
I do.
I ascribe
He
to
likes it.
cold shower happy hour.
Okay, what is the best way to de-stress?
Hold on. I just want to make sure your phone is still recording. Okay. All right.
What is the best way to de-stress? What is the best way to de-stress after particularly hard days?
I mean, you're the expert. I would say you've got a lot of tools. Share your tools.
So especially here, the surgical cases that we're taking here are all just really complex cataracts. So think about a cataract that's so advanced, we call them brunescent or white cataracts. Pupils that don't dilate in patients with severe uncontrolled diabetes, with subtenons anesthesia that I administer myself, 0 anesthesia, so they have no sedation, they're wide awake. So these are very complex cases, and so the complication rate is higher than what I am used to And so when you have one of those days, you really need to have good coping strategies to remind yourself like why you're doing what you're doing and that you really are helping so many people. And even the patients that have a complication end up having much better vision than before the surgery. So you need to remind yourself of those things. So I like to do a lot of mindfulness meditation.
Well, I would say number one, we talk about it.
We talk about
it
we
right
have
away.
Each other.
So that's been huge
Yes.
because like having somebody that you can share and who kind of understands what's going on. Although, you know, I can't possibly understand what it's like to be operating and, you know, having a hard time or any challenges with that. Just the way that she doesn't really understand the true feeling of, you know, somebody passing away during a code that, you know, maybe shouldn't have. But I think on a deeper level, since we have gone through medical training together, we've been together for so long, we're able to you know, talk each other off our respective
Yes.
ledges.
We've been on many ledges, for the record. Like, I remember there was one really traumatic day for Lorenzo in the hospital early on, like our first 2 weeks. And he burst into my OR. I was obsessively cleaning my OR, so that was where I was bleaching the floors because I just couldn't stand it anymore. And I'm in there aggressively bleaching floors and labeling things. He comes in drenched in sweat, pacing.
Because the hospital, parts of it aren't air conditioned.
Parts of it aren't air conditioned, and they had just coded a little baby, and the code went disastrously, and the baby would have passed in any case, and they all did the best that they could, but it was really traumatic for Lorenzo.
Well, because they were missing in the necessary
Equipment.
tools and equipment, and so I ran into the OR to try to find them.
And so we got home that day, and so I could just tell from that interaction with him that he did not feel or look well. And we got home that day, and he didn't talk the whole car ride home. It's a 30-minute commute. He didn't speak. And I didn't bother him because I know what that's like. I know the feeling of just wanting some silence after a long day. And then he threw himself in the water, and I was just watching him from our balcony thinking, I hope he starts to speak again soon, because Lorenzo's a very talkative, bubbly person at baseline, whereas I'm a little more cynical. And after a couple hours, we finally started talking, and like we went through everything, and we were able to share anecdotes with each other and just comfort each other. And I think that is that.
Yeah, the water helped a lot.
The water
I mean,
did.
it's
The water does
not a bad de-stressor to float in perfectly temperate,
Yes.
warm waters
Yes.
and watch the sunset. That's a
Yes.
pretty good.
But other than that, trying to exercise as best as you can, trying to journal, talking with your loved ones, talking with people that understand what you're going through. So I found a lot of solace talking to my mentors about things so that I could get their perspective, which was really helpful. Meditation always helps.
Just focusing on completely other things when we're not working, like going diving or
Yes.
kite surfing. Yeah. Distraction, and more distraction.
What has been our favorite part of this experience?
Our favorite part of this experience.
I think my favorite part, I have a couple different perspectives on this. So first of all, I really love my team here, the ophthalmic nursing team and the public health team. We have grown so much in 2 months. Like, I can see how much better they are now than they were 2 months ago, and it makes me so proud and so happy and just like so excited for the future. And that's something that you only experience with a long time in a place. So it's slow. Change is slow. You don't learn these things overnight. These are difficult concepts. And then from just like a lifestyle thing, I think it's really beautiful here. Like, it's just, you wake up.
I think I might have pressed something. Hold on. Is it still going?
Is it?
Yeah, it is. Okay.
Just like, it's beautiful here. It's just so beautiful here. I mean, despite how hard it is to see so much suffering and to witness that suffering, it is naturally just one of the most beautiful places in the world. We went to this island, Jeep Island. It's a remote island. and
It's inhabited by a dog named Bikini,
Bikini, and
and like a caretaker of the island. And you could walk around the island in about 5 minutes. Like it's like a tiny speck of coral.
so the fact that we get to watch sunset every day on a beach, and that we can watch it from our balcony no matter how tired we are, and that we get to work with these people and to get to know the Chuukese. Like, I think the Chuukese have a little bit of a reputation for being closed off or even violent, but after spending this much time here and getting to know the Chuukese culture and getting to know the Chuukese people, like, you really appreciate and love them. So that's been my favorite part.
Yeah, for me professionally, definitely has been seeing the progress. I've been focusing mostly on the emergency department, although I've been dabbling with the other wards as well in terms of trainings and simulations. But doing simulations and running codes in the ER here has gotten so much better, and seeing people just have an increased confidence in themselves and say like, wow,
So you're taking my answer.
we actually did a good
You're
job.
taking
Yeah,
my
but I
answer.
mean, yeah, it's seeing progress and seeing that your
The progress,
efforts,
it is
seeing
very
that your efforts
rewarding.
are being
Yeah.
are translating into something.
Yes.
When at times it feels, like so hard. And then yeah, also in terms of like leisure time, I would also mention the diving here is unbelievable.
Oh, yes,
This
the
is
diving. I totally forgot about
one of the
that.
best, probably the number one wreck diving site in the world. It's there's I think over 50
I don't know the number.
wrecks,
Could be any
boats,
number.
Japanese boats that were sunk during World War II, Operation Hailstone. For any World War II fanatic, the
Not
U.S. came and basically did a bombardment. It was their version of Pearl Harbor, and now you can see all these massive ships that are at the bottom of this pretty shallow lagoon. So for recreational diving, it's pretty accessible, and it's just been really awesome to see.
Yes, I agree. The diving has been. I mean, the diving off Jeep Island.
And even yeah, we did a shore dive.
We did a shore dive, just us and our friend Shane, no dive master, and we just like went in, and it felt like I was Little Mermaid, and that was my favorite Disney movie growing up. So, it's
I was
just-
Big Mermaid.
You were Big Mermaid. You were
Yes.
Big Mermaid. Okay, so now to some lifestyle questions that we got. What do we miss about being home? Our cats.
Wait, let me hold on. Hold that thought.
Okay, so now for the lifestyle questions.
Are we gonna go swimming again since now you've got shark bait on your finger?
Yeah. We're going diving tomorrow.
No, but swimming here.
Today?
Yeah.
I thought we had the doctor party.
Oh, okay.
I mean, it's already 2:30.
All right. Very well.
Okay. What do we miss about being home? Cats. I miss my cats. I miss my cats.
I think it's food for me.
Food.
Food related.
Yeah.
The biggest difference between here and Samoa, well, one of the big differences is food related. I felt like in Samoa, the local cuisine and food was just more accessible. And here, there's just not that many restaurants. The restaurants that are there are mostly like fried food and very meat heavy. So we're pescatarian, so not very accessible to us.
There
And
is a lot of really great fish.
There is a lot of really good fish,
but we don't want to eat fish every day, which we basically are.
yeah, and surprisingly for a tropical island, there's not a lot of fruit and vegetables that are easily accessible. Like maybe
Taro,
if somebody
bananas.
brings it from their garden, but that's not an everyday thing. There's no like markets to get, local stuff, and which has been challenging.
I mean, there are, but it's very limited. So taro is something that we eat. Taro root. It's a superfood, high in lots of vitamins and minerals. Bananas. They have green mangoes right now. I think we're missing mango season. And then coconuts. Like, those are the local things, plus fish that we've been able to eat. But a lot of the food is like canned, processed, high in sugar, lots of like sodas and sugary drinks. which is
Going
why
into
the
the
rate of
supermarket.
diabetes is like, yeah.
Yeah, like going into the supermarket is really, really, I would say depressing. Because I mean, this I can't read this because it's in Japanese, but this is a coffee that you can get here. But I think that's 10 grams of sugar.
Oh, that's low for
This is
here.
actually pretty good. Yeah, I mean, but it tastes like jet fuel sugar.
I can't.
And
I
but
tell everyone, all
I
my
think it's a
patients.
conspiracy theory.
I do.
Everything has
Has
sugar in
sugar.
it. Everything is in a
Everything.
can or processed. And I think that's also it's just hard to get items here
But
because
it
of
doesn't have to have
refrigeration.
sugar in it. Like, why is
Right.
everything
Well, I think
fortified with
it's
so much
maybe
sugar?
preservative, and I don't know, but
The rate of diabetes here is unbelievable. Like, everybody has diabetes, and the advanced severity of the diabetic retinopathy that I'm seeing is unbelievable.
everybody has diabetes.
Everybody.
Every patient over the age
So
of
food has been a
25 or 30
real
has
challenge
diabetes.
for us. Like, at least in Nepal, we ate dalbat like 3 meals a day. But when we were staying in Kathmandu,
Dalbat power,
dalbat power
24 hour.
24 hour.
Lentils, baby. My GI was
Very, yes, yes. But and we stayed at Nima House with our host grandparents, and they cooked something different every day. So it was just a different experience in terms of food. But other things that I miss, Lorenzo's not as homebody as me, but like, my name Scylla means homesick, and I am, as much as I travel and have been traveling from a young age, like, I love my bed so much. I love the comfort of home, like having my own fridge, having my own kitchen, having my own pillow in my bed. And we haven't had that since like May of last year. So it's been however many months that is,
Let's
7,
not forget
8
your
months.
hot shower addiction.
My hot shower that we've already talked about, and yogurt. Like, not having yogurt has been really hard for, like, these things are just
Is
creature
your mouth watering?
comforts. Yes, my mouth is
You should have
dry.
yogurt. Yogurt.
You miss it.
She actually brought a yogurt starter.
I did, but we don't have access to a kitchen, so that's problematic. Oh, oops, I think I might have just done something. Is this on?
Is there a light?
There's a green light, but not a red light.
It should be a green light.
Okay, our last question that I get a lot is, how do we stay healthy while traveling, and how do we not get sick? So I've had people ask us how we not get sick. First of all,
Now, well, we've learned by fire in Uganda when we traveled
yes,
there. This
Yes.
was like 10 years ago now.
10 years ago.
I think we had like cholera, Hep A.
I was
Like
dying.
we were
You cannot
constantly
convince
sick.
me I was
Just-
not dying.
It was the worst gastrointestinal illness,
For like a month straight.
and yeah, it was very challenging. And since then, we've really fortified
We've matured.
our travel med kit. Like, we always travel with antibiotic for bacteria-related gastrointestinal illness.
There's actually a link to one of our videos. We go through like all the things that we travel with. So
yes,
we
if you
have,
haven't seen our packing video,
yes,
I talk at length about this must-have essential kit
Yes.
of gastrointestinal illness and more stuff.
but
that
we do
is
get sick. Like, I got sick twice
More
when
like
I was
cold and
training
flu
for a
type
marathon.
stuff. Yeah.
Exactly. Like, I had 2 colds back to back, and I was emotionally distraught, but it was during marathon training, and I think that I was under eating because I didn't have the stability of like knowing where I would be the next day, basically. And then Lorenzo got sick once, but we haven't, knock on wood, gotten sick since. And I think part of it is that we use AG1 supplements. We are not sponsored by them, but we really believe in those nutritional supplements when we travel.
or something like that. Yeah, a
Something- yeah, multivitamin.
with all the minerals, especially if you're not having a very wholesome diet, which we're
which
not
can
here.
be very challenging when you're traveling.
and
to
if you
a
have
whole food
dietary
diet.
restrictions at baseline.
Even if you don't, like, having fresh fruits and vegetables here is challenging. So I think making sure that you're getting all your essential nutrients, and we do that through supplementation. I also take vitamin C every day. We carry our own hand sanitizer because it's really variable. The hospital doesn't have very many places with running water. So washing your hands with soap and water is challenging, and the hand sanitizer sometimes can be watered down. So you want to bring your own hand sanitizer. That's one thing that I always try to pack. And then masks. We try to wear masks. I mean, there's a lot of tuberculosis here. There's a lot of infectious disease here. So we wear masks even though we're not worried about COVID technically. We wear masks.
Yeah,
We wear masks
I'm
on
masking the whole
planes,
time in the hospital because
all the time in the hospital.
there is tuberculosis.
Yes.
So
The first few weeks he was coming into my clinic, and sometimes I would take off the mask because it would be really hot, and he was just like, "Put your mask on." He would come
well,
police
that's
me.
usually because I would see a patient with like tuberculosis in their lungs, and I'd be like, "Oh,
Yes.
what is my wife doing?"
Yes, yes,
And but nutrition-wise, we have like a pretty good regimen with our supplements, and then also in terms of staying mentally healthy, exercise.
yes.
Yeah,
Exercise is hard sometimes.
I go swimming every day. Scylla tries to go for a run around the compound here, and
We
even
do like little
just-
workouts.
Yeah,
We have our portable yoga mat. We'll do like little workouts in our room. Just doing whatever you can to stay active and to just take care of yourself so that you can be the best version of you for the community that you're working in, and that you can stay healthy and just be really careful with food. I think when we were younger, we were a lot more
adventurous.
but now I put my foot down. I don't let us do street food from sources that we don't know, because
No
it takes one-
raw vegetables or raw fruit.
Yeah, we're really
That's
careful.
Not something that you peeled, like no lettuce. She takes the lettuce off of all of her burgers, and
yeah, it's just not worth it
yeah.
anymore after what we've been through.
It was a bonding experience. We definitely bonded in a way over that.
So I think that might be all the questions. Let's see. Oh, my laptop's dead.
Well, perfect timing. I guess that was all the questions.
If there are any other questions, you can just drop them below or DM us.
Yeah. And make sure you subscribe if you haven't before. We'd love to show you a little bit more about our life in global health and travel. And thank you.
Thank you.
Thank
you. And thank you.
And thank you.
Okay. That was good.
I'm itchy.
Yeah. Do you want to eat lunch?
Well, I think we
Missed it.
We missed it. 2:30, right?
Oh, I'm not that hungry anyway. What time is this dinner party?
6, but
I'm not getting there till 7:30.
Chuuki's time, ain't no way
Can you give me my
they're
phone?
getting started.
So are we eating dinner